Renin Angiotensin system blockers. Angiotensinogen is a globular protein produced by the liver and released into the circulation, where it is cleaved into angiotensin I by renin enzyme produced by the juxtaglomerular cells in the kidney. Renin is secreted in response to sympathetic stimulation and decreased blood volume. The only non-biological function of angiotensin I hormone is to be cleaved into angiotensin II by angiotensin-converting enzyme, known as ACE or ACE, produced mainly by the liver. Angiotensin II is an important regulator of blood pressure. It directly induces vasoconstriction through its vascular receptors. Additionally, it stimulates the release of aldosterone hormones from the adrenal glands. Aldosterone stimulates the reabsorption of sodium and water from the nephrons. Those effects result in increased blood pressure. Additionally, angiotensin-converting enzyme degrades the potent vasodilator, bradykinin, into inactive metabolites, leading to a more increase in blood pressure. As expected, inhibitors of angiotensin-converting enzyme will reverse the vasoconstriction directly induced by angiotensin II and decrease sodium and water retention effects of aldosterone. Ultimately, these effects will decrease the blood pressure to near normal levels. Similarly, angiotensin-converting enzyme inhibitors will elevate the concentration of bradykinin vasodilators, which in turn lessens the elevated blood pressure. Unfortunately, elevated levels of bradykinin produced by the angiotensin-converting enzyme inhibitors causes annoying bronchoconstriction and cough in a significant number of patients. Angiotensin receptor blockers, known as ARBs, do not affect ACE function, but rather work more selectively on the angiotensin II receptors on the blood vessels and nephrons, producing vasodilation and decreasing sodium and water retention, which in turn decreases the elevated blood pressure. ARBs do not increase the bradykinin levels. Therefore, they avoid the bronchoconstriction and cough induced by ACE inhibitors. Similarly, renin inhibitors like elascorin prevent the production of angiotensin I, which is the main precursor of angiotensin II. It decreases vascular tone and decreases sodium and water retention. Like ARBs, it does not elevate bradykinin levels, and therefore avoids bronchoconstriction and cough associated with ACE inhibitors. To sum up, the physiological effects of ACE include systemic vasoconstriction, increasing sodium and water retention, and protecting the lungs from the irritating bradykinin. ACE inhibitors reverse all these effects. Thus, they reduce vascular tone and decrease sodium and water retention. Unfortunately, they increase bradykinin levels and induce annoying cough. ARB and renin inhibitors have similar vascular effects to ACE inhibitors, but they avoid the cough associated with them.